Hi, I'm Emily, and I'll be talking about the comparisons of healthcare in the United States and Australia. What I'm going to be focusing on is how each nation handles the issues of elderly care and prevention. So let's start with the United States. There's some good news and some bad news. The bad news is that the United States has a higher death rate than Australia. This is a simple graph showing the amenable mortality for both the nations in 1997 to 1998. Australia's amenable mortality was 88 deaths per 100,000 people, while the United States' amenable mortality was 115 deaths per 100,000 people. So in 2002 to 2003, Australia's amenable mortality was 71 deaths, while the United States' amenable mortality was 110 deaths. The good news is that both are taking action to decrease these numbers. The U.S. has already enforced some laws such as the Clean Water Act, plus the United States has organizations such as the U.S. Preventative Service Task Force, which is a group of experts that provide recommendation statements to primary care clinicians and to the public alike. Similarly, Australia has an organization called the Australian Chronic Disease Prevention Alliance. It's similar to the U.S. Preventative Service Task Force in a sense that they both provide recommendations. The other issue that both the nations are facing is elderly care. As time went on, more and more elderly people are moving away from nursing homes and are just staying at home instead. Because of that, the United States is trying to provide more services for the elders living at home, and Medicaid and Medicare helps pay for those services, not the full payment, but a partial payment under certain conditions. Compared to the United States, Australia has a smaller percentage of people who are over the age of 65. Furthermore, they want elders to stay home as much as possible because the decrease in the use of the facilities will be more cost-effective for the nation as a whole. A similarity between the two, Australia and the United States, is that they both have services and benefits, such as these listed on here. Well, there you have it. The similarities and differences of the healthcare of the United States and Australia.